Good afternoon, and welcome to our webinar on poisonous homes, the fight for environmental justice in federally funded housing, presented by the Shriver Center on Poverty Law and Earth Justice. I'm Amber Mentor-Trupa, Vice President of Communications at the Shriver Center. I'll be your moderator for the session, and I just want to highlight a few items before introducing our panelists. First, some helpful guidelines to participate in our Blue Jeans platform. A lot of these icons are on your right side. If you need to contact a moderator one-on-one during the meeting due to any technical issues, use the moderator chat. If you have a question you'd like to submit, please use the Q&A icon on your right. And if you want to interact with other attendees or make some comments along the way, use the chat icon. And during the presentation, the slider bar will change the ratio of the presenter to PowerPoint. And now about us. If you're new to both of our organizations, a quick word about who we are. The Shriver Center on Poverty Law leads a fight for economic and racial justice by litigating, shaping policy, and training and connecting people in the advocacy community. Together, we're building a future free from poverty and racism, where everyone has equal power under the law. Earth Justice is a premier nonprofit environmental law organization. Earth Justice wields the power of law and strength of partnership to protect people's health, to preserve magnificent places and wildlife, to advance clean energy, and to combat climate change. Earth Justice is here because the earth needs a good lawyer. Today's conversation centers on our newly released report, Poisonous Homes, available at povertylaw.org/poisonous homes. You'll find our press release, media stories, and maps, and other relevant information about this study. And after today, you'll also find a recording of this webinar. This report was done in collaboration with the University of Chicago Abrams Environmental Law Clinic and Columbia Law School, with funding from the Joyce Foundation. We thank all of our partners for their partnership and support. Today, we'll hear from Akisha Daniels, community activist, Emily Coffey, housing justice attorney at the Shriver Center, and Debbie Chiselwer, managing attorney for the Midwest office at Earth Justice. Before I turn it over to our panelists, I want to take you to East Chicago, Indiana, where our report authors first met Akisha Daniels and hundreds of her neighbors, and where our report story begins. It's where a century of development in the steel, petroleum, and railroad industries has left a legacy of pollution in the community. So the town is being cleaned up under the Superfund law, a law designed to address the most contaminated, hazardous waste sites in the nation. Let's look at a quick video.
I've got lead in the brain. That's what they say. We all live out here, we got lead in the brain.
More than 1,000 people in East Chicago, Indiana are scrambling to find new homes. Their entire neighborhood is contaminated with lead and arsenic.
First, high lead levels in the soil, and now in the water. Residents in East Chicago can't seem to catch a break.
I moved here in May. In June came and EPA came in and informed all the residents that the soil and the water was highly contaminated with lead and arsenic. I spent at least $300 to $400 a month in water purchases from the store. I use the water that I buy for everything, for cooking, for bathing, for everything. When the Flint, Michigan situation happened, I was buying cases and cases of water to take to my daughter's school so that it could be donated to Flint. It's like deja vu. When I moved over here in May, no one told me about the lead and arsenic contamination. If I had have known, I would never have moved over here. They didn't disclose that. And yet, they called me for this apartment to move over here. Why do that if you knew that this area was highly contaminated?
For that. It was a maddening and sad video at the same time, and I want to bring in a lifelong resident of East Chicago, Akisha Daniels, into the conversation. Thank you so much for being here.
Thank you, Amber.
Akisha, why don't you tell us about East Chicago, Indiana, and the Superfund sites?
Well, my name is Akisha Daniels, and I'm a lifelong resident of East Chicago, Indiana, and specifically the Calumet area, or the neighborhood known as the USS-led Superfund site. The USS-led Superfund site is divided into 3 zones. You have Zone 1, was formerly known as the complex, and also Carrigosh Elementary School, where my kids attended, and me as well. Zone 2 is where my grandmother lives since June 23rd of 1954. And Zone 3 is where I live now. It's also part of the Superfund site, and it's very highly contaminated as well. And the home that I live in hasn't been tested, the arsenic hasn't been tested for lead, arsenic, or even the groundwater here. I moved into West Calumet Housing Complex with 3 children, ages 13, 7, and my last son was less than a month old when I moved into the complex. It's largely single-family homes. The sense of the community was very close-knit. I have lifelong friends that I'm still friends with and I associate with on a daily basis. With some of them, they're part of the CAG, or the group that I'm part of. My family has had a lot of health issues, from heart disease, cancer. My son has ADHD. We have a lot of different problems like rheumatoid arthritis, stillbirths, and a lot of death that has happened in this area over the past couple of years. My son was tested probably when he was about 3 or 4. I found out many years later, when he was a teenager, that his lead levels were at a number 9 back then. And I just found out a couple of years ago, once the lawyers came in and tried to get his medical records, because they wouldn't release them to me, even being his parent. In the summer of 2016, we received a letter from Mayor Anthony Copeland letting us know that we had 60 days to move out of the area. It was really sad. I was sad to leave. This is a place that me and my children had called home for almost 14 and a half years. And we grew up there. They grew up there. My children grew up there. They played in the soil, and my soil tested at a 90,000 parts per million with lead, I'm sorry. The inside of my home tested at a 32,000 with parts per million with lead, and 850 with arsenic inside of the home where we had stayed for almost 14 and a half years. And the EPA states that it should be no more than 400 parts per million. And I learned all this through a letter. I learned all this information through a letter. He gave us 60 days for me and 1,100 other residents that we had to find somewhere to move. The move was very, very trying. 1,100 people, say 650 adults, trying to find the same amounts of rooms, from 2 to 3 to 4 bedrooms, all at the same time. It was kind of difficult finding a place to live. But thanks to the Shriver and the other lawyers, Debbie Chisler, they helped us, get more time. We didn't have to pay rent when we stayed there on the contaminated land, but the fight, is still continuing. We're still fighting. We demanded a declaration of emergency, for the Calumet neighborhood. We met with Governor Holcomb. We demanded funding for new furniture, because I didn't want to take the furniture that was highly contaminated in my home, my new place. I've met with Scott Pruitt. We're still waiting on some of the response from them. The process of searching for a home with a Section 8 voucher was very difficult. I didn't understand the laws in Indiana that a landlord cannot accept the voucher. It's a choice that they have. I viewed maybe over 20 apartments where me and my children's social security numbers were. We still couldn't find any place to go. So when it was about 60 of us left inside of West Calumet Housing Complex, they gave us an option to either leave with a voucher or to move to the public housing of their choice that the East Chicago Housing Authority gave us. My choice that they gave me, well, the one that they gave me was the Ardell Gardens in Chicago, Illinois, where I don't know anybody really in Illinois. I've never lived there, where they were putting me in a position where I would have to change my kids' school, our doctors, and all of our information, which would take time because we just didn't know what to do once we were given this place to go. And this also was another public housing that is highly contaminated in the area also. So now we're fighting because the mayor refuses to say that the site should be cleaned up or the housing so that more housing could be built. Instead, they want to build more industrial inside of the West Calumet Housing Complex. We can't even get them to put up air monitors. We are still fighting to get them to do what's right. And they are removing a lot of homes. I believe it's 671 homes from the Superfund list. They're trying to delist the homes in this area. And we all feel that they are not cleaned to proper standards. And, you know, Calumet is my home, and I will never stop fighting for my home. Thank you.
Thank you so much. We're gonna come back to you to learn more. But thank you so much for sharing. And I want to bring in Emily Coffey from the Shriver Center just to really offer more context for this terrible, egregious case that we saw in East Chicago, and what does the rest of the country look like? I'll pass it to Emily.
Thank you so much, Akisha, for sharing your story with all of us. What the government agencies and polluters did to you and your family and your community is truly abhorrent. And I'm always inspired by your continued leadership and strength throughout all of this. And you and your neighbors, you know, really pushed us as advocates to investigate whether there are other communities like East Chicago throughout the country. And unfortunately, what we found is that East Chicago is not an anomaly. There are other places around the country that, as a result of intentional practices and policy by the federal government to place affordable housing on toxic land, still pose public health risks today. And environmental racism played a central role in the government's decisions about where to build affordable housing throughout this country. Next slide, please. In fact, what we found is that there are dozens and dozens of affordable housing programs throughout the country that are either on top of Superfund sites or in direct proximity, that is a quarter mile away from a Superfund site. And this map that you see right here really shows a couple of different things. It shows that this is a national problem. Nearly every state has a Superfund site in direct proximity to federally assisted housing. What this also shows is that this is both a historic and a current problem. We've built and supported affordable housing throughout the past century that has significantly changed. And some of these programs continue to be built while other affordable housing programs are being rehabilitated today. So what this map both shows us is a historic siting problem about where we place public housing throughout this country, but also a problem of where we continue to reinvest in redeveloping or developing brand new affordable housing. Next slide, please. So how could this happen? The research shows that the federal government has refused to act on this issue despite decades of opportunity to do so. This is a problem caused by our federal government and perpetuated today. Federal agencies have known and repeatedly acknowledged the problem and have refused to act. At the same time, polluting industries negotiate cleanup plans that are not sufficiently protective, and agencies allow this to happen over community objection. This continues in part because of an inadequate engagement of directly impacted families. We don't even inform tenants about the toxic soil that they live on, let alone support them in developing a vision for what their community could and should look like, and then doing the real work of realizing that potential. Next slide, please. So for decades, we've seen countless Black mothers specifically fighting for their communities. I want to highlight 3 examples that are detailed at length in our report, so I encourage you to take a look at our report for more detailed information. First, the environmental justice movement started in public housing. The mother of the environmental justice movement, her name was Hazel Johnson, and she learned that her home was built in what she would later refer to as the toxic donut. She lived in Chicago's Altgeld Gardens community. This is the housing that Akisha mentioned earlier as a public housing development that she was going to be forced to relocate to. Hazel Johnson only learned about the environmental problems after her husband passed away at a young age of environmentally caused illness. She learned afterwards that many of her neighbors had similar stories. As a result, she became an environmental justice advocate. She formed an organization called People for Community Recovery that continues today to fight for environmental justice on Chicago's Southeast Side and at the federal and state levels. The next example is Love Canal. The advocacy from Love Canal residents resulted in the creation of the Superfund program. You may have heard of Love Canal as the infamous story of a man-made environmental disaster, a suburban community built on top of a toxic landfill. But what is less well known about Love Canal is that also on top of that toxic landfill was a public housing development called Griffin Manor. Racial tensions between some of the homeowners and public housing tenants often left Griffin Manor residents out of important decisions that were being made. The Concerned Love Canal Renters Association fought for the residents of Griffin Manor to ensure that they received compensation and the ability to relocate. What this story shows us is that even at the formation of the Superfund program, the connection between federally assisted housing and hazardous waste sites couldn't be more clear. And then in the late 1990s, a public housing development called Washington Park in Portsmouth, Virginia, made national headlines. Washington Park was built on the footprint of a lead smelter, similar to West Calumet in East Chicago. The Washington Park Lead Committee fought for relocation benefits for public housing residents, but government actors refused, even though public health officials at the same time were recommending that residents find temporary housing for their pets. They were telling residents that they could not relocate. So the Washington Park Lead Committee sued the Housing Authority and federal agencies to allow them to relocate on the federal government's dime. The Washington Park Lead Committee fought for more than a decade to finally receive this just relocation that they were seeking. Now, Washington Park happened 17 years before Akisha and her neighbors at West Calumet learned that their homes were also built on a Superfund site. In the immediate aftermath of Washington Park, HUD acknowledged and even wrote a report acknowledging this issue and affirming the government's commitment to addressing it. It's now been 4 more years since West Calumet was in the national news, and we cannot allow another decade to go by without deliberate action. Now I want to pass it over to Debbie Chisewer, who's going to talk about some ideas for solutions.
Thank you so much, Emily. And I just want to pause and say that I learned so much about housing laws from working with Emily. And I have so much admiration for you, Akisha. You continue to amaze me. For years now, Akisha and her other community leaders have come out week after week, no matter what, to fight for the health of their families and their communities. And with the support of this coalition of lawyers and with organizers' help, they advocated successfully for so many changes, not just the ones that Akisha mentioned about rent abatement and funds for relocation, but they also advocated for testing of the drinking water. And when they learned that it was contaminated, they advocated for lead service line replacement. They advocated for indoor dust sampling and remediation of lead dust and lead paint. They advocated for the addition of properties that had been left out of the original cleanup plan. And they advocated for an improved demolition plan for the housing complex that would protect residents who were still living adjacent to that complex. They fought for more public participation. As Akisha mentioned, she's part of the community advisory group that was created by residents. They also fought for more public meetings so that people can engage with agency officials and try to get their questions answered. Their fight is not over. These victories cannot take away the pain and the health impacts of living on a lead and arsenic contaminated site. But their fight did inspire us to take on the work of this report. We had 3 goals. We wanted to learn more about other sites like East Chicago so that other communities could be better protected. We wanted to build off the victories in East Chicago and advocate for changes in the way EPA and HUD make decisions about housing, construction, redevelopment, and the management of contaminated sites. And we wanted to encourage other advocates to do this work, and we wanted to alert community leaders to the tools that are out there to support their fights. As Emily said, many times HUD has acknowledged this before, and once again, in January of 2017, HUD and EPA, recognizing their failures of communication, agreed to investigate lead-contaminated sites. We wanted to do this, prepare this report so we could have clear recommendations for EPA and HUD to do better. When we looked across the country at hazardous waste sites that involve lead contamination and had federally assisted housing on or in close proximity, we learned that too many people are currently living in harm's way, and most of them don't even know it. This must end. Where you live should not determine your health outcomes. Our housing and environmental laws must protect all communities. Next slide, please. Some of the very troubling findings included that there is a failure to ensure that residents are notified of contamination. There's a failure to give residents choice about where to move if contamination is found. When housing inspections are done, there's a failure to include environmental health concerns. And finally, HUD is failing to take a hard look before investing in the construction and redevelopment in contaminated places. Next slide, please. Today we'll share a few high-level recommendations. We encourage you to read the report to learn more about these recommendations and many others. First, prevention. We can make better decisions about where federally assisted housing is built and rehabbed. We need to prioritize the health of all communities by enforcing laws that prevent pollution and the health consequences up front. Funding. Where we spend money reflects our priorities. For contaminated sites, we should prioritize cleanups where the health of Black and Brown low-income communities are at stake. To make this happen, though, the fund designed to pay for cleanups of contaminated sites, the Superfund, must be restored. Disclosure. As Demetra said in the opening video so powerfully, why would anyone call her to move into a contaminated site? If it was disclosed that she was moving into a contaminated site, she wouldn't have done so. We must require disclosures across the board. Next slide, please. Next slide, thank you. So we also want to center the community. Here you have one of Akisha's colleagues in this fight, another community member advocating for change. It's critical that EPA centers the community in the planning and remediation processes, and that HUD and housing authorities respond to the needs and requests of their residents. If EPA engages community members early in the process, they'll learn that residents know best how they interact with the site. They know what paths they take. They know what they're experiencing in their homes. It will help agencies better determine the pathways of contamination and possible health impacts. We have found that residents consistently request technical support in understanding complex reports and the legal process. Both advocates and agencies can do more to empower communities to participate in an informed way. Agencies must also communicate early and often about the risks and provide effective methods for reducing the harm. Next slide, please. Decision-making should be inclusive. Residents deserve to be at the table where decisions are made about their homes, not just government agencies and polluters. The interests of the agencies and the public don't always align, and we need the perspective of the impacted community at the table to reach the right remediation plan. When agencies are sharing materials, they should do so widely, and they should follow best practices for language access and tailor the materials to the impacted community. And public meetings should be held when people can attend them. They should find out from the community when is the best time to schedule a meeting. And community members should help set the agenda. Next slide. Very importantly, sites must be remediated so that residents can feel safe to live on them when the remediation is done. Partial cleanups don't protect the residents in the long term. And currently, there are many cleanups being done that aren't backed by scientific evidence. Current standards don't reflect best information available about health impacts. A very simple example. EPA still relies on an outdated blood lead level standard, 10 micrograms per deciliter, as the standard for which it's trying to clean. The CDC uses a different standard, and EPA hasn't updated its standard to match the CDC's. I would like to turn it back to Emily so that she can help us talk about where to go from here.
Thanks so much, Debbie. So where do we go from here? What are some next steps? Next slide, please. We all know that there is not a one-size-fits-all solution to this issue, and that's clear from Akisha's story and the story you heard from Demetra as well. We cannot unilaterally say that all affordable housing developments in proximity to a Superfund site should be handled in the same exact way. The vision for the future must come from those who are most directly impacted, and that's the tenants. When those who have experienced environmental health impacts of where they live drive decisions about their future and the future of their community and what that looks like, that's central to achieving environmental justice. But what does that look like for all of us here today? There's some critical next steps that we think can get us closer to achieving this vision. First, it's critical that we are convening people to discuss how to make systemic change and develop broad-based policy solutions. We need to urge elected officials to propose legislative changes grounded in some of the recommendations in the report, and that is centrally to make the visions of those most directly impacted able to become reality. Third, foundations and government agencies need to ensure that housing and legal services advocates have the resources to do more of this work and to collaborate with environmental justice lawyers. And most significantly, They need to fund community-based organizations and directly impacted people to do this work and to do the visioning that is necessary to move us towards systems. I'll pass it back over to Amber now.
Thanks. Thank you. First, again, thank you to the three of you, Akisha, for your voice, for your testimony, for your advocacy, and Emily and Debbie, thank you so much for the data and contextualizing all of this for us. We have had a lot of questions come through the chat. And I think one kind of key theme that was coming was just people just wanted a little bit more grounding on Superfund, on what a Superfund site is. So if somebody wants to just give a quick explanation of that at a high level, then I can dive into some other questions.
Sure. So I see the question about the Superfund sites, how we selected the Superfund sites that were part of our analysis. And we specifically focused on lead contaminated sites that were located in close proximity to federally assisted housing. So these are sites that still have pose a risk to residents living at the site.
Okay, great. So folks, again, the Q&A function, it's live. We will try to ask some questions from here, and we may try to respond to some along the way. Akisha, there was a question. If you could talk a little bit about the media coverage that occurred during in Chicago. A lot of reporters and others descended onto the community, as well as the government response. If you just want to talk about that experience and how the media kind of talked about the situation there.
We had a lot of media coverage in the beginning. I've met with someone, Jordan from the Young Turks. I did interviews with a lot of different people. They came in to see what we were feeling and how we were adjusting to what was going on around us. Meeting with the governor was something that I had never done before in my 40-some years of living in Indiana. Meeting with Governor Holcomb, he really took the time to listen and understand, and he put things in motion to get things handled. But they stopped covering us after a while. It's like we were hot for a minute, and then within months, everyone disappeared. So the coverage was good for a minute, and then it just stopped. So right now, the calls are few and far in between, and that's all I can say really about it. It still should be covered daily because we're still suffering here in East Chicago, Indiana.
Yeah, can you speak a little bit more about just like what the community, what's it like there right now?
Basically, it's kind of hard to ride past where you used to stay. For weeks after leaving the complex, I myself, and I know some other people, would still be driving to where our homes once were. It's still devastating to ride past this area. It doesn't feel the same. This whole area is just like a desert, basically, from where the complex used to be. They're demolishing a lot of homes that used to stand. So there are just vacant lots everywhere on each and every block where there used to be homes from family members or friends of the area that used to stay there. It's basically just like a desert. It doesn't feel like home.
Do you still keep in contact with your neighbors? Is there still that sense of community?
I keep in touch with a lot of my neighbors. Some have moved to the Maryville, Indiana area. I keep in contact with some that have moved to Texas, some that have moved to Atlanta, some have moved to Alabama. So we're everywhere. A lot of people didn't choose to stay in East Chicago. So it's a hurting feeling to know that, people that your children grew up with for 10, 12 years are so far away, but I still try and keep in touch with the families and keep a lookout on how their health is going, because no one from the housing authority is reaching out to us and they have no contact with us. So we just no tracking. There's no tracking of what is going on with our health, our safety, or anything. And a lot of those people left with the furniture, the clothes, and stuff out of those homes that were highly contaminated as well. So I think they should have did a better tracking system.
Yeah, Debbie, what role do public health officials play in like monitoring the long-term health of residents?
Thank you for that question. And more needs to be done. EPA can seek health surveillance costs in their cost recovery action under the Superfund law, and that would allow the creation of some kind of program like a Flint registry or something to help residents stay on top of any potential health concerns that would arise from living on this contaminated land.
Thank you. We're getting a lot of questions about the maps, and very specific questions that we may have to follow up with folks on. But I don't know if Emily, you wanted to just speak to just kind of recap the maps again, because there were a lot of questions about what sites were used and any other just details you can offer on that would be great.
Sure. So we plan to make all of the data more publicly available. We're in the process of doing that right now, and you should be able to find that on our website in the near future. I think there were some questions about the different colors in the map that show different affordable housing programs. And so, that shows the low-income housing tax credit program, which is the biggest driver of the creation of new affordable housing in this country, and also the biggest driver in financing the redevelopment of existing affordable housing. It shows public housing, which is largely speaking older developments that were built many years ago, that currently are most likely to be in the process of being rehabilitated under a program called the Rental Assistance Demonstration, or RAD. So that is also shown in this map. Last, you'll see rural developments. So these are older developments that are overseen by the U.S. Department of Agriculture.
Great, thank you. Really, to all of you, we cannot, obviously we're in a moment right now where, we're saying that we're in dual pandemics. We have COVID-19 that greatly is hitting Black and Brown communities the hardest, highly exacerbated by pre-existing conditions. People are talking about environmental justice. And then we are in a moment of racial awakening, understanding and talking about structural racism. Where do these issues intersect? Anyone want to answer that one?
Sure, I can jump in. I'd love to hear from Emily and Akisha afterwards, but we know that Black and Brown, as you said, we know that Black and Brown communities are the hardest hit by COVID. And we also know that these are the communities that may have comorbidities from being exposed to disproportionate amounts of air pollution and other harm. And all of these issues point back to the structural racism that has informed or infected our housing policy and our environmental policies, and it's time to break down those systems and make change to better protect communities.
One theme of accountability keeps coming up. Who's responsible? We have a question that just came in. Who's responsible for choosing these sites? What role does the federal government? Is this local authorities? Can you guys walk us through that decision process if you know?
Emily, why don't you talk about the housing? Yeah.
Debbie, do you want to? So I think in terms of what we looked at in the report, we were looking at different sites based on the type of affordable housing program that they were part of. We wanted to make sure that, we've heard that HUD is doing or was doing at some point an internal analysis on certain types of affordable housing programs, but they were just looking at public housing in the project-based Section 8 program. So we wanted to pull in other types of affordable housing to make sure that those those agencies are being captured and that those affordable housing residents are being included as well. So Debbie, I wonder if you could talk a little bit about the Superfund designation process and how that process works. I think there are some questions about what Superfund means
Sure.
and how a program gets listed.
Sure, and the program, as Emily mentioned earlier, it was the law, the Superfund law known as CERCLA, was promulgated because of Love Canal. But what it reflected was that there was thousands of sites across the country that had contamination that had not been addressed, that had been left behind. And the goal of the statute was to provide a mechanism for cleaning up those sites and then providing for the cost recovery from the responsible parties, the polluters. So when we talk about a Superfund site, we're really focusing on sites that are on what's called the National Priorities List, which means that when a preliminary evaluation was done, it was determined that they were so contaminated that they needed urgent attention. Right now, there are approximately 1,100 sites on the Superfund list still. And one of the things that was so shocking in East Chicago is that the site itself was first proposed to be added to the Superfund list or the National Priorities List in 1992. It was not ultimately listed until 2009. And then residents didn't learn about their risk and the exposure, the extent of it, until 2016 when, as Akisha explained, when they learned that it was so severe that they needed to move out and their homes needed to be demolished. And that's where the systems break down. Even though there's this process to have a site listed and includes public processes, the processes often don't really engage the community, or people can move in after the original process and not learn about the site.
I have a couple more questions, but I just want to take a pause to remind everybody we're here for Poisonous Homes. The report is on our website. I believe we are putting that in the chat and in the Q&A, povertylaw.org/poisonous homes. You can download the full report there. As Emily mentioned, we're working to make more of the data in our map publicly available in the near future. So I just want to reiterate that for folks. We had a couple of questions, kind of just related, just joining on to what you said, Debbie, about just testing and discovering around the exposure. How has the exposure to residents been found? Is it through air or water monitoring? Complaints about blood testing? If you could speak to that.
Yeah, absolutely. And again, I'm just going to use East Chicago as an example. And one of the things, and then also to expose some of the horrible things that happened. In 1997, there was some construction work being done at the Carrie Gosh School that Akisha was talking about, where she attended and her children attended. And EPA and the state environmental agency noticed this construction and also knew that the site was contaminated. So what they did was they arranged for the state health agency and the federal health agencies to do a study of the lead levels of children living in the public housing adjacent to the Carrie Gosh School. What they learned in 1997 was that 40% of those kids had elevated blood lead levels. And that was at a time where the standard was much higher than it is today. These health agencies recommended that the state environmental agency conduct a cleanup, but nothing was done. So nothing was done from 1997 all the way until 2016. Now, in answer to the broader question about how is this contamination found, EPA in evaluating a site will conduct soil sampling, may do some air monitoring, depending on where the water is, could do some water sampling. At this site in East Chicago, they had not done any testing of the drinking water because the drinking water source was from Lake Michigan, and they just assumed the drinking water was fine because it wasn't associated with the soil contamination from the lead smelters. But in fact, because there were aging lead service lines, much like Flint, and they hadn't been treated adequately, with anti-corrosion control, the lead was getting into the drinking water. So residents had exposure from the drinking water, exposure from the soil, and then from tracking that soil into their homes or blowing in through their windows, there was dust in their homes and they were breathing that dust as well. So there are lots of ways to test the contamination, and we should not wait until it harms children, because there's no safe level of lead in the body. So waiting to test children to figure out if we need to act is not the way to handle this. We need to be more proactive about it.
And just, Akisha, again, you talked about this in the beginning, but you feel like you have seen generations of health issues in your family, correct?
Yes, I have 4 aunts that never made it to age 60 that grew up in this complex or in around the surrounding area, Zone 2. They mysteriously just developed different forms of cancer. It was already in stage 4 when it was found. They all just passed away. So this has been a reoccurring act in this area, all 3 zones. I know of hundreds of people that have had different forms of cancer, and they don't have a history of cancers in the family. It was very disturbing to see that after they removed us from the housing authority had an auction sale of these different things inside of our houses, which were the hot water tanks, the sinks, the toilets. All of these things were highly contaminated. So these things left outside of East Chicago. So these different appliances are in homes close by, maybe Wisconsin, maybe Illinois, and these people are still being contaminated, and no one thought to tell them that this wasn't a good idea to do. They auctioned off the air conditioning units outside. This area was so contaminated, it was just shocking to see that they would sell anything. And no one thought to stop them, not our mayor, not our governor. This is just things that shouldn't happen. So now I'm worried about where those appliances ended up and what children are being fed, or the mothers are keeping that milk in that refrigerator or that stove, or the different things that are being, it was just taken nationwide.
Akisha,
And those children aren't being tested. Those parents aren't.
Yeah, I was just going to ask about the community, just the community testing, because there was another question that came in, and Debbie and Emily, you guys may speak more to broader community testing. But right now, do you regularly test? Do you know if they offer regular testing in East Chicago?
I haven't been tested, me or my children, since this first started in 2016. The health department hasn't reached out to us. They haven't even notified my children's doctors to let them know that we live inside of this lead contaminated zone. So the pediatricians haven't been notified. So there are thousands and thousands of kids that have moved elsewhere outside of East Chicago, Indiana, and the doctors still haven't been notified. So these children are still being damaged. There is no testing done in East Chicago. I really don't believe that the health department has enough people to even test all of the people in East Chicago. Some people would come in town for a day we call Calumet Day. It would have been this past Saturday. And we were trying to get more people when they come home to visit to be tested, and the health department wanted to charge them to be tested. And I just thought that it should be free. You have people here that come back once a year, and a lot of people didn't get tested. They wouldn't even set up a booth outside at the Calumet Day, and we don't have any clinics or anything studying what lead and arsenic has done to our bodies through over the years. So that's something that we need here in East Chicago. We need some clinics to study what the effects of lead, arsenic, and God knows what else we are being exposed to on a daily basis.
So obviously, go ahead, Debbie.
I was just going to add that East Chicago and Indiana are alone in that. Many states are behind or negligent in their testing of young children for blood lead levels. This is a problem around the nation.
And just talking about advocacy, there was an extensive advocacy that Shriver Center and other partners, particularly our report authors, did on behalf of residents to help with relocation, along with all of the community members. We had a couple questions about litigation. Is there like any ongoing litigation that you know of at either at East Chicago or at other sites? Just and especially with the current administration, just like what are the opportunities for change right now?
So I think one thing that we really learned through investigating this report is that there's a lot of people who are unfortunately unaware of these connections. A lot of advocates are unaware that they are representing tenants that live on a Superfund site. They might know about the public housing, but are not aware of the environmental link about what's going on in the community. So I'd say that is really currently one of the key barriers, that there's a lack of communication across different types of advocates, and this is part of the challenge in terms of coming up with a systemic response. I would say too that in terms of legal claims, we're happy to talk with people offline if there is potential litigation somewhere. But I would say that we can't ignore the pretty obvious civil rights challenges that come along with this issue, and the civil rights laws, the Fair Housing Act provides ample opportunity for advocacy.
And I would just add that there are legislative fixes. We talked about restoring the Superfund under CERCLA. That is a fix that would really change the way that decisions are made at sites, because it would take away some of the power that responsible parties have right now in the negotiations, because they're often paying for the cleanups. If there was a Superfund, there'd be more flexibility there. We also advocate for stricter following of NEPA requirements by housing agencies when deciding whether to construct or rehab homes. And that law is currently, the Trump administration is trying to gut that law. And so the need to reverse those efforts is critical. We need to make sure that this law that is designed to make sure that we have public input into decisions is held firm.
So I want to close with Akisha. Akisha, we've gotten a lot of comments, and I think the hundreds of us on this webinar right now that are just angry, frustrated, want to support, want to help. And Debbie and Emily have walked us through some helpful recommendations, things that we can do to change policy. What do you want to let folks know about your experience? How can we help? How can we support you?
First, we need a lot of prayer. That's what we need in East Chicago. Secondly, I would tell every young person that's trying to find somewhere to go to do their research on where they're moving. Make sure they do a complete research on what was there prior to, and know all of the history of where they're, because that was something that I should have done prior to moving to West Calumet Housing Complex. The things that we need here in East Chicago is that we need people to push our mayor and our government to do what's right. There has been no type of fund set up for our children that are going to have long-term care, and they're going to need long-term care because of what the lead and affected their bodies and done different things to them that are lifelong. I just don't, every time I talk about this, I get upset. But I just want people to make sure that they know where they're going and, just do their research on everything about where they're moving to prior to moving in, and just, keep East Chicago lifted up in prayer. And if you have any ideas of what we need to do to push our governor or our mayor or our city and public officials to do more, we would take all advice.
Thank you. Thank you so much. We certainly will we'll stay in touch. I know a lot of people are going to stay in touch with you. And thank you to everybody who asked questions. We may be following up with you. Again, Akisha, you are a force. We are here for you. We're going to keep on with this fight. So thank you so much for sharing your story with us. And Emily and Debbie, thank you again and the report authors for all of your research and elevating this in the public conversation. And so I just want to bring up our slide with our URL. We are going to hopefully continue to keep building out more resources and support. So povertylaw.org, Poisonous Homes. We will have the recording of the webinar. Just give us about a day. We hope to have that up shortly for you, and we will email you and let you know as well. povertylaw.org/poisonous homes. Again, I'm Amber Mentor-Trupa. Thank you so much, all of you, for being here, for joining the Shriver Center on Poverty Law, Earth Justice, community activists of East Chicago, to talk about this important issue. Please, what you can do right now, continue the conversation on social media. Talk to your organizations, talk to colleagues, let them know about this issue. Talk to your elected officials. We need to start with conversation, move to change. We can do this. We'll be fighting together. So thank you all, and have a great day.